Okay, my name is Ilumaya Rivchpp. I was referred to this hospital to this year because of I have the blood pressure, high blood pressure and three protein in my urine. They referred me yesterday. And when I came here yesterday, doctor said I will go for CS immediately that the baby life is at risk. So I went to the CS yesterday.
Okay. Hello, everybody. My name is Ihuo Trust, and I'm a beneficiary of the Rivchpp insurance program in Rivers State. I registered for antenatal at Rivchpp Health Center, and I've had previous cases of preeclampsia. I've had eclampsia involving convulsion with my previous pregnancy, and this pregnancy required more attention and more money. But all thanks to Rivers State government, I gave birth through cesarean section for absolutely no penny. So to others out there that might have issues that might involve more expenses during delivery, please enroll for Rivchpp and benefit from the program. Thank you.
Morning, Port Harcourt. Good morning, our beautiful viewers all around the city of Port Harcourt. I am here with the amiable head of department health services, Dr. Binin Timpa. How are you doing, ma?
I'm good.
Amazing. Okay, so we'll go straight into the video. The two ladies talked about cases of preeclampsia, and the first lady particularly talked about having protein or seeing protein in her urine. Please, Mark, could you walk us through the concept of preeclampsia?
Thank you very much for the opportunity. Preeclampsia is a medical emergency that occurs in pregnant women, and most times it occurs after 28 weeks of pregnancy. And it usually requires a specialized treatment. What happens in preeclampsia is that a woman who was never hypertensive or probably had a previous history of hypertension suddenly starts noticing that her BP is increasing. Aside BP increasing, sometimes you discover that when a urine test is done for her, there is protein in urine, just like one of the beneficiaries mentioned. Aside protein in urine, you could also discover that their feet are usually swollen. Sometimes you find two of these symptoms I've talked about in the women. At other times, you discover that all three, from raised blood pressure to protein in urine to swollen feet, are all included. And once it is like that, you know that something needs to be done, or else either the child will die, the mother can also die, or both the mother and the child can die. So you see why it is a medical emergency and has no place in a primary health facility. So it must be dealt with in a secondary or tertiary health facility. Thank you.
Thank you very much, Ma. All right, so they said these were the reasons for their being referred from a primary health facility to another facility. Okay, so Ma, please, what other factors could be a reason for a referral from a primary health facility to another facility?
There are several factors that will make a primary care doctor to refer a patient from the primary facility to the secondary facility. First and foremost, the primary facility is designed to take care of cases, primary cases. And once the case becomes a secondary case and requires a specialized treatment, that patient must be referred to a secondary facility as soon as possible. Cases that can be referred from the primary facility to the secondary facility are numerous. But let me start with the obstetric cases. We have talked about your preeclampsia. Eclampsia, it's also one thing that cannot be found, cannot be managed in the primary health facility. Eclampsia is like the senior brother of pre-eclampsia, because in eclampsia, all the features I mentioned earlier will be there. But in this case, there is an additional history of convulsions in pregnancy. So once the woman is convulsing with pregnancy, you know what can happen. Either the mother can die, or the child can die, or both of them can die. And once that is noticed, that person must be referred to a secondary facility as soon as possible. Aside eclampsia, We need to refer cases of diabetes in pregnancy, even just hypertension in pregnancy, histories of recurrent miscarriages, because you can never tell what has been causing the recurrent miscarriages. So once you have gotten that history, that person must be referred to a secondary facility. Asthma in pregnancy, a sickle cell disease patient with pregnancy must be referred. We also have gynecological cases that must be referred. Cases like breast lump, where they need to do a lumpectomy. Cases like fibroids, we commonly call them fibroids, where a myomectomy needs to be done. For the men, we also have cases like hernia. We could have cases like cases like appendicitis that needs to be sorted out. We also have other specialized cases like that of the eye, where an ophthalmologist needs to see, that of the ear, where an ENT surgeon needs to see, that of the teeth, where you need the dental surgeons to see, and several other cases that includes the orthopedic surgeons and other specialized cases. Thank you.
Thank you so much, Ma. You've mentioned quite a lot. Thank you so much for that very much detailed answer. All right, to our viewers, most of them who are pregnant women, you can hear from our HOD Health Services, Dr. Barinemi Timpa. It is very important for you as a pregnant woman to be enrolled into the River State Contributory Health Protection Program Health Insurance Scheme so that you can be monitored early. And if any of these complications should arise, it will be important that the doctors see them early, detect them early, and if possible, refer you to a secondary facility. All right, it's until we see again on another beautiful episode of the Rivchpp Testimony Thursday. Bye bye for now.